All right, so I am Michelle. I'm one of the dietitians at the Pancreatic Cancer Center. So I am talking today about nutrition considerations surrounding pancreas cancer. If everybody just wants to make sure that they're muted too, that would be wonderful, just so we can all hear nicely. So my understanding is there's people from all different hospital systems. So I wanted to say it looks like there's a great lineup ahead. Maybe Olive already prefaced that, but thank you for kind of kicking off the month with me talking through nutrition. I'll talk about the different things that I do with my patients at Freighter in Milwaukee, Wisconsin. But I did want to say that if you are seeing any of the tips that I'm giving, and I'm sure that you've all gone through so much. So if you have any other tips that have worked for you or experiences you've had about the topics that I talk about, please feel free to type it in the chat so we can share some of that at the end so that we can be sort of interactive with each other too. At Friedert, I also wanted to say the dietitian services are very prevalent here, but I know that they're not at every cancer center. So if it's something that you leave today thinking it would be great to have a dietitian in your corner, that would be something to ask your oncologist about at home. It is at least in Wisconsin, it's a free service for patients, which is really wonderful. But you can check into that as well to make sure if you're going to be billed, but it is not billed in Wisconsin. And we talk about a lot of different things as far as side effects that are affecting nutrition, pancreatic enzymes, unintended weight loss, and we'll go through all that today. So thank you again. So these are the objectives, what we'll briefly cover today. So the first thing is to being in our GI tract has a lot of nutrition implications. So there's a lot of different things to consider with that. We'll go through the major functions of the pancreas and how that affects nutrition as well. Common nutrition-related side effects and then strategies associated with pancreas cancer. That's while somebody's going through chemo, radiation, or surgery. And then we'll just briefly touch on different trends in cancer nutrition, including survivorship, and then some resources for you. So as far as the role of nutrition, I mentioned that there's a relatively high risk for nutrition issues with pancreas cancer specifically. A lot of that has to do with the functions of the pancreas. So we have our exocrine and our endocrine function, which I'm sure all of you have heard of, and we'll go through more briefly. And then also we have a lot of different side effects from the chemo and the radiation and the surgery, and we'll touch on some of the most prevalent ones. So that exocrine function has to do with fat absorption. So that's something that I help with our patients a lot. So basically what happens when we eat is our pancreas releases something called pancreatic enzymes from the pancreas into the small intestine to help us digest our nutrients, especially fat. So someone going through any part of the treatment or after a surgery may experience pancreatic exocrine insufficiency, which basically means that your pancreas is not producing enough of those enzymes into the gut to digest what you're eating. Therefore, some of the nutrients, especially fat, will go undigested and lost in the bowel movements, and it will lead to the unpleasant symptoms that are listed on the screen: indigestion, cramping, a lot of gas, and such. So there's a couple of different enzymes that people will take. So one of the brands is called ZenPep. I want to make sure I can see my... Oh, wait. So this is the example of a little capsule. This is going to be a 25,000 unit capsule. They come in all different dosages. 25,000 is maybe, if there was a standard, what I'd call the standard dose. So I'll show on the next slide. Basically, we calculated based on what people's bowel movements are doing. So if someone came to me with like 6 bowel movements a day and they're floating and they're tan, lots of gas and odor, I would know they're having quite a bit of pancreas insufficiency. So they may need more than somebody who is maybe going twice a day. Occasionally it's floating, occasionally it's tan, but it's formed. That person might need a lower dose and less capsules. So we really dose these enzymes based on how bad the people's symptoms are and how much it takes to get that normalized. So we increase as needed until the bowels are pretty normal. We go slowly though, because if you take too many, the side effect could be becoming constipated. So that's really important to know. There's also a few additional tips for succeeding with taking your pancreatic enzymes. So usually what we'll do is we'll start with maybe 1 or 2 of these with each meal, and then 1 with a fat containing snack. So for example, if you ate ice cream, you would take 1, but if you just had some fruit, you technically could skip it, because again, these enzymes help with digesting fat. If someone is needing multiple capsules throughout the meal, then what we would have them do is stagger them throughout the meal rather than taking them all at once. This is going to better mimic what the pancreas does, because normally when we eat, our pancreas is going to release the enzymes throughout the meal. It's not going to just know how much you're eating right at the start of the meal and release it all at once. So that's one tip. Another tip that I see some success with as well is to open the capsule onto applesauce. So the picture on this slide shows the little granules. So what you would do is open that capsule, sprinkle the granules onto applesauce. You know, if you're taking 4 capsules with the meal, you sprinkle all 4, mix up the applesauce, then you take the applesauce throughout the meal. That's because the applesauce contains pectin in it. That is a bulking agent for our bowel movements. But then also we have a subset of patients that don't tolerate the digestion of the capsule all that well. So if that's something that you think might be going on, that could be something to try. I already mentioned to take it with snacks that have fat. Don't crush or chew it. And then if you have an iron supplement, you should separate the time that you're taking each of those, because the enzymes can reduce how well iron is absorbed. The other important thing that I'm sure if you're on enzymes, you may or may not have gone through, there's a lot of different brands, and insurance may or may not be very picky with what they cover. So I wanted to list different brands here. If you are experiencing issues, that you could ask your insurance or your doctor, hey, can you help and see if any of these other brands would be covered for me? There also are assistance programs right now for both Creon and ZenPep. Some of them can take maybe about a month at least for our patients to kick in, but they do help with the coverage often. So that would be something to inquire about. ZenPep, I know for sure, has a nice coupon for patients with commercial insurance as well. ZenPep also within the last 1.5 years has started offering a 60,000 unit capsule. So in the past, their highest dose was a 40,000 unit capsule, which is more than the other brands as far as dose. And that would be something to look into if you are having a lot of issues with pancreas insufficiency. That higher dose may be something you benefit from. So like I mentioned, it's very individualized as far as how much people need. Sometimes someone will tolerate a different brand or a different dose, and working with your team is really important if your bowels are not normalized yet on enzymes. So the other big function of the pancreas is the endocrine function. So again, we just talked about the exocrine function, fat absorption, but the endocrine function ties more into carbohydrates. So the pancreas is involved with processing fat and then carbohydrates as well in a different way. So the pancreas produces insulin to help maintain our blood sugar control. So if somebody is, going through treatment and possibly after surgery, their pancreas may not produce as much insulin as it's supposed to, and then that individual may need a medication agent to help properly control their blood sugar. So if that is going on, it's possible someone may just need an oral agent or they may need insulin with each meal. At Freighter, our endocrinology team is very specialized and helps our patients outside of our department. So that's a really nice collaboration of care here, but really important to have good blood sugar control. Low blood sugar can be dangerous and can lead to unpleasant symptoms too, like sweating and dizziness. But then long-term, people can have issues with heart, with kidney, and with vision loss. So now moving on to nutrition-related challenges. As many of you, I'm sure, know, this can evolve over time. It may start before you're diagnosed and may be the reason that you kind of find out about your diagnosis to begin with. But for most people, their experience with nutrition evolved throughout their experience with pancreas cancer. Some of the most common issues are loss of appetite, unintended weight loss, taste changes, and GI issues. It's so important that you find strategies to work through this because there is what a hospital system might classify as malnutrition, a fairly high prevalence of malnutrition. You guys still hear me?
Yeah.
Okay, good. My computer was making me question. Okay, fairly high prevalence of malnutrition, which is basically loss of your strength, loss of your muscle mass and body fat, often stemming from unintended weight loss and not eating well enough. The better someone's nutrition is, the easier it is to get through treatment, and then also the easier it is to recover from surgery as well. For a loss of appetite and unintended weight loss, if I had a patient coming to me with this, oftentimes one of the things that they will say is they feel full quickly. So we recommend that they, instead of aiming for 3 big meals, we recommend instead eating 5 to 6 small meals per day. You also could word that as 3 small meals and 2 to 3 snacks. That sometimes is a little bit less overwhelming of a way to think about it. Or 3 small meals and 2 to 3 supplement drink choices too. The reason supplements can be helpful for someone going through pancreas cancer treatment if they're feeling full on food. Sometimes people find, as I'm sure some of you have experienced, sometimes it's easier to fill up on liquids or to drink liquids than actual food. So balancing both of them is fine. A focus on high calorie, high protein foods, if your appetite and intake are less than it should be, is really important because those are going to be your foods that help to keep your muscle mass on and your body sustained and nourished. Fruits and vegetables are fabulous, but if you want to fill up on your protein foods first to be able to maintain that strength through treatment, and then fill in with the fruits and veggies as well. But for long-term diet, absolutely balancing your meals. There are appetite stimulants. If somebody is having this loss of appetite, they're doing their small meals, but it is just too difficult and they're really not able to eat as much as they should. Those are medications that you could ask your doctor about, may or may not be appropriate for you. It's very individualized. But the take-home message is weight stabilization really does matter. From the research, it's associated with improved survival, quality of life, and surgical outcomes. Some oral nutrition supplements, I just wanted to point out, there's a lot of them out there, so it can be confusing on what to try, but it also really depends on what your needs are. So if you don't have a dietitian, that would be a good reason to ask for a meeting with one, just to say, hey, I know there's a lot out there. Here's my issue and what I'm looking for. If you're somebody who needs to focus on weight gain, the sugar content doesn't matter, like you're not having blood sugar issues, you just need calories. I really like this one called Boost, very high calorie, because it is 530 calories. And if you're not eating a lot of other foods, that can really make a big difference. On the other hand, if you're somebody that is having lots of nausea with your treatment, or needing to really zone in on hydration, maybe your calorie intake's okay, but you need to hydrate, get a little more protein, a little more calories. The Ensure, the Boost Breeze, and the Oath protein powder are all really nice products. They are all clear liquids. The Oath is a powder that you'd mix with water, and it kind of would taste like a lemonade, depending what flavor you buy. I also wanted to show one that's brand new that my coworker brought in today. This was from Costco. Let's see if I, so it's called the Sparkling Protein. And I think actually Olive told us about it, and then we looked into it, and it's really nice. It's 130 calories, and it's actually 30 grams of protein. So sipping on something like this throughout the day, if you need more protein, could be a really nice option. The last one I want to point out is in a calorie. So that's, it almost looks like an applesauce jar, but it's a little gel packet that you could add to pudding or oatmeal, or applesauce. And it's just called a food enhancer. It's 330 calories, not flavored. The only issue with that one, it's very helpful for weight gain, but it is high in fat, so you'd need enzymes if you're currently taking enzymes. And also, unfortunately, it goes in and out of stock a lot, so it sometimes is on back order. That changes week to week. Some of these two are only online. The Boost Very High Calorie and that Ensure and Boost Breeze are a little hard to find in the stores. Most of the other ones are pretty available in stores except for Kate Farms. That's going to be a vegan one, but it's really nice because it is 450 calories in the 1.4 variety. So again, only online, but if you choose to be vegan, or if you have an intolerance to some of these other ones that have dairy, that could be a really nice alternative, and that variety is nice for gaining weight. Homemade smoothies are also a really nice option and often tend to be pretty economical because you can use ingredients that are not pricey ingredients per se. Like you could do any kind of milk, whether you want it to be plant-based or dairy milk. You could put peanut butter, any frozen fruits in there if you want to add another protein powder, or you could do like Greek yogurt. That would be a nice option for making something yourself. This next side effect is taste changes. This one I see not uncommonly with chemotherapy specifically. There's all different types of taste changes. So one person might say that food tastes like metal. Another person might say that foods taste too sweet. So if I have a patient with taste changes, I always ask them for a little bit more information to figure out what kind of taste changes they're experiencing. But for example, if it's metallic, avoiding utensils that are metal and avoiding food that comes from an aluminum can would be two of the recommendations. Across the board, these first two bullet points tend to be helpful, and that's to incorporate a baking soda mouth rinse. If you're experiencing dry mouth, you should omit the salt. But what that baking baking soda does is to basically cleanse the palate. You swish it and then you spit it out right before you eat. So the other thing that tends to be helpful is to use sharp flavors and seasonings. So vinegar, lemon, chili powder, tart cherries, a couple other ones could be barbecue sauce and soy sauce. That's those heightened flavors tend to taste good to somebody going through taste changes. So basically, if you needed like a dressing or did a lemon bar or a pasta with like a lemon vinaigrette, that might taste good. So yeah, baking powder or baking soda. I need to double check on
You
my
take enzymes, does your pancreas get sluggish?
If you're taking, sorry, someone just said, I think, if you're taking pancreas enzymes, does your pancreas get sluggish? Yeah, if you're taking too many enzymes, you might get constipated. And then, so if you are constipated on enzymes, you should ask your team. You may need to back down. That'd be something to just double check with them, but possibly. And then I did have a typo that I just realized when I was talking. It on this last slide, it's not baking powder, it is baking soda. So I will correct that. Thank you. Oh yeah, the topic of the sluggish question about sluggishness. Somebody also may get constipation as a chemo side effect, and a lot of people are constipated just at baseline. If you are experiencing constipation, if you're on enzymes, we already said maybe reduce the use of enzymes. But also you may, unless you have something like a duodenal stent or some other reason that you can't have fiber, you may want to add the fiber-rich foods slowly into your diet. So that would be fresh fruits and vegetables, maybe some beans, nuts. Those foods help to move food through. So that would be something to consider. Hydration is really important with constipation, as is movement, just like taking walks and such. Hot liquids especially tend to work well, especially a product called Smooth Move Tea. Smooth Move Tea has something in it, has derivative of the senna plant. So like the senna medication is derived from a plant, and that Smooth Move Tea has extracts of that. That would be something to consider taking or drinking. It's just over the counter next to all the other teas at the grocery store. Some foods can be binding. What I've observed is that some people are more sensitive than others, but some binding foods could be cheese, bananas, or white rice. So if you notice that you eat cheese and you get more constipated, that would be something to maybe reduce a little bit how much cheese you're eating. That is not the case for everybody, though. Your team may also want you to take a stool softener or a laxative. That would be a discussion between you and your medical team. I'm just trying to move on to the next slide. There we go. On the flip side, diarrhea is really prevalent. I would say I see this a bit more often, but I certainly see both. So if a patient is experiencing diarrhea with chemotherapy, really common side effect. The end of radiation, common, and then after surgery, also pretty common. So we have to differentiate, oopsies. Differentiate between, is it a need for more pancreas enzymes or is it a side effect from your treatment? If it's a need for more pancreas enzymes, we would work on adjusting that, and we would know because you'd be having more tan, floating, odorous stools. But if you're having a treatment side effect, it might be more like you're running to the bathroom after you eat, like loose brown stools. And that may be a matter of reducing how much fiber you're eating, sometimes limiting simple sugars and sugar alcohols. So for example, like a sugar-free drink might have sugar alcohols that people are sensitive to. Limiting dairy, that especially like regular milk would be classic. If you drink a glass of regular milk and then you feel bloated or have to go to the bathroom after, you may benefit from trying lactose-free milk. lactose-free intolerance is very much on a spectrum. Some people are only sensitive to milk. Some people are very sensitive to all sorts of dairy products. And then finally, same, work with your team if you may be appropriate to use anti-diarrhea medications or soluble fiber. That would be like often a powder that you might mix with orange juice, Metamucil, Benefiber. Those are over the counter, but you should talk to your doctor before trying those. As far as the diet goes, you would want to limit foods that we're used to hearing are otherwise healthy for a general healthful diet. This would be more what I would call a symptom management diet. So sometimes it feels counterintuitive, but we're really trying to target the bowel issues and limit the foods that can exacerbate those issues. So limiting nuts, seeds, whole grains, beans, and then fruits and vegetables, specifically those with skin or seeds on them. So for a fruit, that's really counterintuitive. It's like blueberries and grapes, of course, have seeds on them. But if you wanted an apple, you could do that, but peel it. With vegetables, though, it's anything with seed or skin, but also some additional ones that tend to be gassy. So like leafy greens, and then cauliflower, broccoli, those may increase gas and diarrhea. Adding more soluble fiber-rich foods can be helpful. For example, bananas, oats, and applesauce, cheese and rice. These all are more binding foods. And then really important to make sure you're hydrating properly, especially if you're having a lot of diarrhea. You're losing a lot of fluid with loose stools. And if that is the case too, it might be helpful to have electrolyte containing drinks. One that I wrote here is called Drip Drop. Also something you can talk to your care team about, but some patients really benefit just to help replace the losses from their loose stools. So getting into surgery, so if somebody is surgical and able to have their tumor resected, depending on the location of the tumor, they may end up having a Whipple, distal pancreatectomy, or total pancreatectomy. I won't get too deep into the details on that, as I know a couple of the surgeons are talking this month as well. But as far as nutrition goes, it is so important post-surgery. And then because of that, it's so important pre-surgery as well. Poor nutrition is generally associated with a slower healing process and malnutrition. And then also the surgery itself puts somebody at risk for having some GI symptoms, especially while they are healing. So addressing both of those pillars with your team is helpful. The dietitians at Freighter see everybody going through a pancreas surgery. I know that's not always the case at other institutions, but could be something that you inquire about, just to have somebody looking at your weights and looking at if you are having issues with nutrition after surgery, getting a little bit more detailed as to what are your barriers, what are some general food ideas that you might be able to incorporate. Small things can really go a long way after surgery on helping you turn the corner and get over the hump. Our goals for nutrition after surgery are going to be to just restore getting enough nutrition to nourish your body, maintaining your weight, because there is often some degree of unintended weight loss with these surgeries, improve your bowel pattern. Some of our patients benefit from a low-fat and low-fiber diet post-op. Not everybody needs to follow that diet super strictly. So again, that would be individualized. And then hydration, so important while you're recovering from a surgery. Because part of the pancreas is removed, these individuals may need some degree of insulin or enzymes. That's all in a spectrum. And so we work with each individual patient to determine their needs. I wanted to just profile a few recipe resources that over time I've found to be helpful. So the first one, since this is part with the Sina Magwitz Foundation, this is just something to keep your eye out for in the next couple of months, something called the Sina Megwitz Care Kitchen. So they will be compiling some recipes with some suggested modifications based on what different people are going through treatment. So just stay tuned in the future for that. Another really nice recipe resource is called cookforyourlife.org. This blog also has a weekly recipe recap if you wanted the weekly emails. But I really like this resource because you can filter it by your treatment side effects or what your goals are. So if you're having diarrhea, you could ask for them to filter recipes that are appropriate for diarrhea. If you're trying to gain weight, you can have it filter high calorie recipes and so forth. And then if you're in perhaps a survivorship phase, you're on surveillance and just trying to maintain a good, healthy diet, and you're not having any GI issues, there's a lot of good prevention and survivorship recipes too. That's just a general plant forward type of diet. So that's something to know about too. That blog offers recipes for that. And then the Pancreas Cancer Action Network has some recipes too. Just to touch on briefly, because I know when you might look up cancer nutrition, there's a lot that comes up and it can be really overwhelming. And part of this has to do with cancer nutrition should be so individualized, but there's a lot out there that tries to kind of tell people that everybody should do this or that, and that's not necessarily true. It really depends on what phase of treatment you're in, or if you're perhaps in the survivorship phase, and then if you're having side effects from any treatment or long-term having any side effects, because you may need to be modifying diet according to that. And then also some patients may have different vitamin deficiencies. We would be addressing that on an individual basis. So there's a lot of different factors to think about, but survivorship is a topic that's definitely growing as far as cancer nutrition. This would be somebody who is on surveillance, kind of farther out from surgery, no GI issues, and they would just encourage, it's basically an encouraging of following a plant-based diet, lots of fruits and vegetables and whole grains. There's a lot of good research around what's called phytochemicals in these foods for the prevention of cancer and the prevention of cancer recurrence. So just something to be aware of if you see something like that in the news. Vitamins and minerals, like I said, are very individualized as far as what somebody would need. Vitamin D is fairly common for pancreas cancer patients to need, but again, would be something to talk to your team about based on what your levels are showing. And then the ketogenic diet and intermittent fasting are kind of hot topics that go in and out as far as how much is in the news about these. But there's theories around whether both of these diets might help in terms of side effects from chemo or helping the treatments to work better. There's been a lot of mice studies, but the human studies are not very robust. So basically, there's probably more to come on that. And at this point, we don't recommend those across the board. They are very hard diets to implement and stick with and can lead to a lot of unintended weight loss and malnutrition. So we like to be really cautious with the use of those diets. Occasionally they have a time and place, but very much individualized as far as if someone would follow those. So that would definitely be a conversation with the team on that. In summary, proper nutrition essential while you're in treatment and a potential surgery. We're trying to prevent unintended weight loss for the most part, and then managing side effects each step of the way between blood sugars, pancreas insufficiency, and then diet modifications to address any side effects and weight stabilization. Thank you all. I can take a couple questions. I think I saw one.
Yeah, there's a couple in the chat already.
Okay.
I don't know if you can see them, otherwise I'd be happy to read them to you.
Yeah, I can see. Yeah. Salty foods taste terrible to me. Have I heard of this? I have absolutely heard of this. That's often a chemo side effect, and sometimes it can linger for a while. So the recommendations, we have a taste change handout that we give, and we say to eat lower salt foods, first of all, and avoid processed foods because those can be more salty. But then also sometimes sugar or sugar substitutes can cover that flavor, or 1/4 teaspoon of lemon juice can help the taste of salt as well. Having a gastroparesis study and EGD scope in 2 weeks. What do they typically find with these tests? That's probably more of a doctor question, if I'm being honest. So I will stay in my lane on that one.
We
And
are
then
having Dr. Evans, our surgical oncologist, and also Dr. David So, another surgical oncologist, speaking. Dr. Evans is going to be this Thursday at 5 Central, and then Dr. David So will be on Monday the 17th at 5 Central again. They might be better at answering that question.
thank you. Yeah, great. Recommendations for a protein shake for a diabetic. Yep. So, and that kind of varies too. So if somebody is maybe on insulin with meals, there's a couple protein shakes that would be good with snacks. So this is nothing is one size fits all, but sometimes if someone needs insulin with meals, their snacks would be low sugar, maybe 15 grams or less. This Ensure Max could be used as a snack option. It is 7 grams of carbohydrates. And then the other brand is called Glucerna, Glucerna. And both of those are sold in stores. Next, I keep hearing cancer loves sugar, and that going on a low carb, low sugar diet helps. Yeah, that is something to definitely talk to your team about. So the topic of sugar feeds cancer is technically classified as a myth that is very confusing. So essentially, sugar or carbohydrates fuel all of our cells, including our brain cells and the cells that we need to keep healthy, right? But cancer is composed of cells. So that's where that theory or that notion comes in. But to some extent, we need some carbohydrates to fuel us. But the general consensus or recommendation is to just eat a moderate, balanced diet. Nice balance between between protein, some carbs, and some fat for the most part. However, if somebody is experiencing a lot of unintended weight loss and just nothing is sitting well except something that's sugary, that is the time and place to be having more sugary foods. Like if ice cream's the only food you're going to tolerate and you're otherwise going to lose a ton of weight, it's more important to get calories than to worry about eating no sugar. I've also observed some patients ending up trying to really cut out the carbs in their diet, and then they end up losing a lot of extra weight because they're just not getting enough calories in general. So those are the considerations. Talk to your team and ask more for you specifically. What about wanting to maintain weight loss after surgery and chemo, 4 years with no evidence of disease? That's fabulous. Yeah, I mean, I guess that is also something you'd have to talk to. Like, for example, if you're wanting to maintain, what I'm guessing is that this person lost weight after surgery without trying, and now just wants to maintain that weight. We definitely see that if the person is able then to maintain their strength and their muscle mass and their energy level at that new weight, and as long as they're not underweight. So I need more information, but just generally speaking, that's what I would say, but cross-check with your team. You noted Imodium versus Lomotil. Do you find one is more effective to control diarrhea resulting from the irinotecan chemo? Yep. So this chemotherapy, irinotecan, is often associated with diarrhea. Imodium is available over the counter, but I would only take it if your doctor is aware and recommending it. Lomotil is going to be a prescription and it is stronger. So in theory, if your diarrhea is really bad, it's not responding to Imodium, then perhaps Lomotil would be appropriate, but you would need a prescription and need a plan from your team. So, because some of our patients will take it as needed after having loose stools, some will actually take it more preventatively. What helps with a low vitamin A and a low iron? Okay, a couple of things. To be honest, if we have patients with either low vitamin A or low iron, we supplement those with a outside supplement, and how much iron or how much vitamin A depends on what your level is and for how long, like how long you would have to take each. And then we generally will recheck the level and then regroup. But so someone who might have like a vitamin A or a vitamin D deficiency, those are fat soluble. So I would also wonder if that person is needing maybe some pancreas enzymes or like not digesting all their fat, because vitamin A and fat digestion go hand in hand. So you'd have to regroup with your team on that. Oh yeah, and this person takes quite a bit of Creon. Yeah, I would probably need a little more information, but you're welcome to reach out to me. Or you're welcome to reach out to me if you find that you need more information or want to give more information or aren't getting an answer elsewhere. Any protein shakes that taste better at room temperature? If you can't have anything cold when on chemotherapy. Oh gosh. I mean, honestly, this is really personalized. It depends if you're sensitive to sweetness. If you are, the Ensure Max is kind of nice because it's not as sweet. Also, something I like to recommend with that cold is that you could do hot cocoa, add protein powder, and make it with whole milk. That could be a really nice option too, because then it's going to be hot. You also can honestly do like soup and add a little plain protein powder to it. Beneprotein or Pure Protein are two brands that have a plain, so that could be something to look into. I have a referral for a phone consult with a dietitian at Freighter. Maybe you, or it might be me. Yeah, I have, I work with a lot of pancreas cancer. I have two other colleagues that will work with any of our GI cancers too. Should I wait until after chemo to see what my issues will be? Not necessarily. We could give you some introductory material. I have a handout called General Nutrition with Treatment. Whether it's me or someone else that ends up calling you to the person who asked this question, you could request that handout, but we could at least just establish, and then you can just make sure to ask us. I always do this, but make sure they see you around your second cycle again, so that at that time you've already established, introduced each other, but then you can regroup around the second cycle to see if issues have come up. I hate the taste of the creamy Ensure. Is Ensure Clear okay for protein consumption? It's 8 grams of protein, 22 vitamins and minerals. It also has 30 grams of sugar. Yeah. For the, just as a blanket statement, yes, it's fine, especially if you're someone needing more calories, needing more protein. It's not as much protein as some of the other options. If you're trying to not do much sugar, or if you're on insulin, this one that I mentioned from Costco called the Sparkling Protein, it's 30 grams of protein, 130 calories, and it has less than 1 gram of sugar. it does contain milk. It's from whey protein isolate. But it's pretty good. It tastes like a bubbly water, but a little bit sweeter. So they must, whatever flavorings are, yeah, it has sucralose in it. Any other questions through the chat or out loud? I appreciate you all giving up your evening and speaking with me. You're also welcome. I'll just put my, you're welcome to reach out. I know I said that to somebody from one of the questions. So this is my, my name, my phone number, and my email address. So don't hesitate to reach out if you'd like.
Can I ask a quick question?
Yeah.
Too late? Where does concerns about cholesterol come into all of this? For instance, if I'm not concerned about my diet necessarily, I seem to be maintaining okay and eating very balanced, but I find that through all this, I've been eating more dairy products and cheese and whatnot and ice cream and whatever to keep the weight on. And where does concern about cholesterol come into that?
Yeah,
Or
we
does it?
definitely, yep. To some extent, it maybe doesn't unless you've had issues in the past or heart issues. I would ask to get your cholesterol checked, and if that, then at least you can see where you are. That question would be totally huge spectrum, right? If somebody has a lot of heart issues that we know of, they come in with high cholesterol, I'm going to be more cognizant. But if the goal, otherwise heart healthy, never, they haven't had high cholesterol that I've been cued into, I'm not that worried. I'm more worried about them just getting enough calories and protein.
Michelle, are you able to unblur your background and re-show some of those protein shakes that you were showing earlier?
Yeah.
Just because they were blurred out a little bit once you were showing them.
Sorry.
Thank you.
Office here, so I was okay, this is the one I showed a couple times. Genius Gourmet Sparkling Protein. This is the one that's no sugar, 30 grams of protein, 130 calories. This is the other low sugar one, Ensure Max. It's going to be 150 calories, 30 grams of protein, 7 grams of carbs. This is going to be a creamy one. The one I don't have a sample of is Ensure Clear, but that's also a nice clear option, but more sugar. This one's Kate Farms. They have a 1.0 or a 1.4. If you're needing to gain weight, the 1.4 is really nice because it's 455 calories. It is vegan, so if you either are vegan by choice or have a dairy issue, good option. And then, yes, someone just commented. So two things. Yes, but it shows that it's sparkling, which can cause gas. I agree. So if you want to try to open it and then stir it, it may be that if you have a lot of gas, you might just not tolerate it. But like you would with soda, try to get the bubbles out or leave it out for a little bit, or sip it throughout the day. I don't have a great answer for that, but it's just a new product, so I wanted to share. The Kate Farms is only online. And yes, someone says my husband likes the taste. A lot of people say that they enjoyed the taste if they don't like some of the like boosts and Ensure aftertaste. So that's something to know. They also have a plain flavor that could be helpful if you're trying to make your own shake or you just don't want like something that's chocolate or vanilla. Yeah, and somebody else said my oncologist told me to stay away from sparkling drinks. Yeah, unfortunately, all of this is on a spectrum, right? So we show you what's out there, and some of it may or may not be appropriate for you. So I think it's good that you're cued into what your needs are, and you might take away a couple new things from this, but unfortunately, it might not all be something that works for you. But good to know what's out there. Orgain is another vegan option. So this one is more accessible. Kate Farms is just online, but this one is at some of the bigger grocery stores and Target and that type of a place. They have powders and they also have just your kind of commercial bottled shake. The powders are nice because you can then make up your own protein shake. You could put it in with some milk. You could use plant-based if you want, and peanut butter and cocoa and all of that. Yeah, and somebody else said I used that one, and then Garden of Life, which they have a lot of different products out there. Is there an amount of water you suggest drinking daily? I don't provide a blanket statement on that. I would individualized if you are at Freighter and want to ask me individually. I don't provide a blanket statement because if someone also has like heart issues or kidney issues and has to be on a fluid restriction, just not one size fits all. What's the best plain protein to add to soups and cocoa? Bena protein is nice. Pure protein has a plain protein powder. And then if you needed just calories, that Bena calorie is okay as well to add to different things. Any thoughts about bone broth? Yeah, the bone broth is nice because it's a little bit higher in protein compared to the other broths out there. So definitely a nice option to make your soups or to sip on bone broth throughout the day to get a little more protein. And then any mouthwash recommendations for taste aversion. Some people will use that biotin. I just recommend that our doctors would recommend that more, but I just do the 1 cup of water, 1/4 teaspoon of salt, and 1/4 teaspoon of baking soda. Is it true that coconut water has a lot of saturated fat, and the saturated fat is the #1 cause of diabetes? So #1, yeah, that's a probably a controversial discussion about the cause of diabetes, but I don't think I'm looking up some nutritionals for coconut water. Yeah, I don't think coconut water would have a lot of saturated fat. It would come from like if you bought canned coconut milk, the like thick white part would be where the fat is. So individualized. I mean, it's if you're not otherwise having issues with heart health, using that in moderation is okay. Just talk to your doctor if you're having issues. Yeah. Anything else? Anyone comes up with anything else, feel free to let
Thank
me
you
know.
for taking time out of your evening to do this too.
Oh, you're welcome. Thank you for attending. Thanks for all the great questions.
Thank you, everybody, for joining and participating. This was great. Thank you, Michele, again, for sharing your evening with us. Very informative. Again, these are recorded and we should be posting them at the end of November after all the lecture series is done. If interested, the rest of this week, we have medical oncologist Dr. Kamgar with us on Wednesday at 5 Central again. If interested, the link that you use today will also work on Wednesday. But if you want to sign up, use the same Qualtrics that you used, and I'd be happy to get you on that if you're not already signed up. And then on Thursday, we have surgical oncologist Dr. Evans joining us. So he will be doing a talk as well this week. But otherwise, thank you all for joining us this evening.
Thank you.
Thank you.
Thank you.
Thank you.
Someone with a 917 area code sent a photo and said, Vote tomorrow for lifelong Democrat and prosecutor Diana Florence from Manhattan. Paid for by Diana Florence, from New York. Replies stop to opt out.